Infertility is the inability for a couple to conceive after a continuous trial to conceive for a period of 1 year. So approximately 1 in 8 couples experience infertility, and this number doesn't pertain just to the US, but perhaps worldwide, where about 15% of couples experience infertility. Historically, the idea has always been that women have or experience a higher rate of infertility. Well, the literature proves this to be completely inaccurate. We know that approximately 20% of infertility that couples experience comes directly from the male factor. And additionally, another 30% is a combination of male and female factor infertility. So really, what we know from literature is that about 50% of infertility appears to be due to at least partly male factor infertility. So generally speaking, our guidelines recommend that couples do try for 1 year with the use of ovulation kits and several other tools in order to conceive. However, if a couple has knowledge that they have infertility due to a variety of reasons or medical conditions or surgeries or treatments that they've had in the past, that they seek fertility care rather quickly with both a male fertility specialist as well as a female fertility specialist. Now, having said that, we know that couples in this country and worldwide, really, at least in the Western world, are attempting conception at a much later age. Which means that there is a certain rise in infertility as both male and female age goes up. And therefore, those couples that are trying to conceive, especially after the age of 35, perhaps should use a shorter time frame, around 6 months of trying to conceive naturally. And if this isn't successful, then really getting care or at least information about their fertility. So the first consultation, at least from a male factor standpoint, does involve many questions as it pertains to your history, including your childhood history, treatments that you've had in the past, your behavioral and lifestyle history, including things like smoking, tobacco, marijuana, as well as alcohol consumption. Certain lifestyle factors such as use of hot tub saunas and a variety of other things that I would typically be asking. That first consultation also includes a physical exam. We are looking for particular causes of male infertility in that exam that really helps me understand whether there's an underlying problem that a male has. And ultimately, that first consultation will result in us obtaining a semen analysis in order to really understand what's happening under the hood, so to speak. And that really is sort of the tell-all. That's the main answer that we're seeking. What does the semen analysis look like? So as it pertains to male fertility, there are several causes. We sort of label them as fixables or unfixables, and there's probably a category of causes that are sort of the unknowns. Perhaps the most common known cause of male fertility issues is typically an exam finding, an anatomic finding called varicoceles. And this is something that I'm looking for on exams, particularly when a man comes in to see me with abnormal semen parameters or abnormal semen analysis. Additional causes include hormonal issues, such as having hypogonadism or low testosterone, as well as pituitary organ issues. There are medications that are also causative and can cause male factor infertility, and behavioral or lifestyle things that I would typically be addressing. These are what we call sort of the fixables or fixables of male fertility issues. Then there's the unfixables. These are typically genetic abnormalities that patients could have that would explain male factor infertility.